The side gliding and standing lumbar reset is great for anything from unilateral low back pain to radiculopathy to specific kind of SI pain. I just want to give a couple clinical pearls for that. The first one is that patients often kind of try to flex and unknowingly cheat their way out of that. They have difficulty loading the involved side. If this side was the involved side, they tend to flex, or maybe they bring their hip back. So make sure their shoulders are stacked over their hips, or maybe even in slight extension. You could also possibly start them in an anterior pelvic tilt if they're very lax, like a lot of the gymnasts that I treat. The next thing is that this has got to be perfectly passive. So you use your arm and your web space to push as far as you can, and then at the end range, they tilt their head a little bit more. What often happens is that people tend to want to keep their eyes level due to the vestibular system. So if they're side bending their head to the right, the head and kind of leads the neck and the trunk. So the body kind of thinks it's supposed to be side bending to the right. So make sure that they're fully relaxed and get the maximum end range, because end range is where the magic happens by side bending their head to the left. Keep the shoulders stacked over the hips and possibly start in an anterior pelvic tilt for very lax people. I hope these tips help. You get the maximum amount of benefit from side gliding and standing, which is a great lumbar reset.